I think all of us, there's a sense of well-being when you're out and about in the summer. And, when we're talking about sun safety, we're not talking about avoiding those activities entirely. I think it is important for people to be physically active. It's a matter of not obtaining excessive ultraviolet exposure and specifically burns. I think people probably accumulate more sun damage than they necessarily appreciate just by being out and about. Even if it's a short walk, you can actually do damage to your skin even without getting a burn. So in terms of the advantages, of course vitamin D is a hot topic. Probably most people get more sun than they need that would generate vitamin D in the summer. What it's usually quoted as, you need about 20 minutes of limited sun exposure, so it would be your hands and your face, about 3 times a week. Now there'll be some people who may be older or vitamin D deficient that might require more vitamin D than they could obtain that way, and the safest way to supplement that would be with oral supplements. There's a threshold of vitamin D production that you can achieve by getting more sun. So for example, you can only go so far by going out in the sun. Your body will only generate so much more vitamin D, and then you just keep causing more damage. So I think there's a sense from the tanning industry that everybody's vitamin D deficient and everybody should be using tanning beds or going outside. And there's some debate about the benefits of vitamin D. We still don't know what's the safest or what's the best amount. We still don't know for sure if vitamin D is a protection against certain kinds of cancer like breast cancer. It's still being worked out. But in the meantime, I think if people have concerns, the safest way to augment their vitamin D is with oral supplementation. I think, certainly working in a dermatology clinic, you get a sense over time of the cumulative effects of sun exposure. And just as a test in yourself, if you look at your arms and you look at the number of moles and freckles you have on this part of your arm relative to this part, you can see what the sun does over time, even just with what may be non-intentional sun exposure. So more moles, more freckling, more photoaging, so we see more wrinkling, and then of course precancers, and then actual cancers. So we see a fair amount of non-melanoma skin cancers like basal cell carcinoma, squamous cell carcinoma, and certainly those are much more common in sun-exposed skin. So basal cells, for example, in the head and neck area or in the back. We see melanomas as well from sun exposure, and there are other risk factors with melanoma. So, our main concern, of course, is people getting too much sun and getting skin cancers. We know in particular that in this part of the country we have a more fair-skinned population, and we do seem to have an increased tendency in our population specifically towards melanoma, almost twice as much as the rest of the country. So I think we have to be more aware of that kind of risk and advising people appropriately about their sun exposure. It's hard to comment specifically on basal and squamous cell carcinoma. I don't know if the statistics for that are documented as rigorously, but certainly for melanoma, Nova Scotia and PEI have always been neck and neck as having the highest rates in the country. So for example, for a population of every 100,000 people in Nova Scotia, for males and females, it's around the same. It's around 20, give or take, per 100,000, whereas across the country it's around 11. So it's a little higher in Nova Scotia in particular, and again we don't really know why. It may be a genetic effect, it may be the type of sun exposure that we get, which is intense intermittent. It may be more than one factor, I guess, but we have to recognize that for some reason our population is at more risk of melanoma, and we have to be vigilant to that. Basal cell carcinoma is probably the most common skin cancer we see. Generally speaking, they're seen about 15 or 20 years after you've had a lot of cumulative sun exposure. Not always. You can see them in younger age groups, those 30 and 40 years old. Basal cell carcinomas often present as, say, a non-healing area or a sore. often on the head and neck, sometimes on the back with a red scaly area that's non-healing and it's been there for a while. It could mimic eczema or dry skin. Any sore, non-healing bleeding area on the face, you should consider a basal cell carcinoma. Squamous cell carcinomas we see from chronic sun exposure as well. They're often a little more raised or warty-like. They can be ulcers as well. And we see those more frequently in people who have suppressed immune systems. Melanomas, there are different types, but the classic presentation of melanoma would be a dark mole that was growing or changing. Most common area we see those in females would be on the back of the leg, whereas we see them more commonly in males on the back. So any mole that's dark and irregular or changing over time, it should be examined and make sure it's not a melanoma. I think the basics most people remember, and you know, as far as avoiding the midday peak times, like between 10 and 4, looking for shade when you're out, wearing hats, wearing cover-up clothing. Probably some of the things that where it gets missed and people get burned. People might be out for a little longer than they anticipate. So even in cloud cover, if you're going to be out in the middle of the day, you need to wear sunscreen. Generally speaking, especially if you put it on 20 or 30 minutes before you go out. The nice thing about some of the physical blockers is they work generally as soon as you put them on. So, you know, if you're on your way out the door, it's better to put it on still. And I like the higher SPF ones of 45, for example, and although the SPF between 30 and 45 doesn't necessarily give you that much more, you know, UVB coverage, and I think that's a question people ask, why 45, not 30? You get a better broad spectrum effect, and you know, I think there's probably a little more room for error if you don't quite put enough. You do have to reapply the sunscreen. Putting a sunscreen on first thing in the morning isn't a license for unrestricted sun exposure. So, you know, you can't put it on and then go water skiing all day and not reapply it. You're going to burn. It's going to get washed off. There are waterproof and water-resistant sunscreens, but you still really need to reapply it frequently. When you look at a sunscreen, the SPF only speaks to the UVB. So if an SPF of 30 means, you know, you can stay out a little bit longer than you ordinarily would. But it doesn't necessarily give you a specific number about UVA. That's why it's important when you pick a sunscreen to make sure it says broad spectrum. Even more favorable is to have a sunscreen that has a physical blocker like titanium or zinc, which will cover UVA, as well as having often, you know, some of the higher SPF ones will have a chemical blocker as well, like Mexeril, for example, that blocks the UVA rays as well.